Okay, good afternoon everyone and welcome to this annual members meeting for Liverpool University Hospitals NHS Foundation Trust. My name is Sue Musson, I'm the chair of the trust and I'm absolutely delighted to welcome you to a meeting of firsts. This is our first annual members meeting as a merged trust and also our first virtual annual members meeting. I want to start by saying thank you very much for taking the time to join us. We've enjoyed absolutely incredible support from our membership, from the public, from our stakeholders, and we never take that for granted. We really appreciate it. So thank you for being with us tonight and continuing to take an interest in the work of the Trust. Let me start by outlining the programme for today's meeting. As those of you who may have attended annual members meetings in the past will know, the purpose of the meeting is to present the content of the annual report and accounts to the membership, giving a flavour of key achievements and challenges relating to the most recent financial year and highlighting some current and future developments. Annual members meetings are also an opportunity to engage with the membership of the Trust and with our key stakeholders, to strengthen relationships, to build knowledge, and to encourage a good two-way dialogue. So we would much prefer to be meeting with you in person and having an opportunity to chat informally. But obviously, with the current situation with COVID-19, that's just not an option. Despite the virtual nature of tonight's meeting, despite the complexity of the year that's just been, and despite the current challenges that COVID-19 continues to present us, we very much hope, though, to deliver on those objectives through our programme. And the running order will be as follows. So I'll start with a very brief input to set the scene and to describe the strategic drivers that have influenced our activity in 2019 to March 2020. Then our lead governor, Andrew Moran, will present the Council of Governors report, highlighting those key areas of contribution that governors have made over that financial year. Then Steve Warburton, the Chief Executive of the Trust, will go through some details of our performance and also highlight some areas for our future focus. And then Paul Fitzsimmons will give us a case study around the integration of some of our key services and the difference that that's made for patients. My hope is that by the end of the meeting, you will feel more knowledgeable about the key developments that have shaped our last financial year, and hopefully you'll share with us our commitment to the work of the future. So let me start by setting out a little bit about our strategic journey from the 1st of April 2019 to 2020. It's been a very eventful year for us. And I think it's perhaps simplest to think of the year in two halves. So the first half started in April and went on to the 30th of September 2019. In that period, we were still two separate trusts, still the Royal and Aintree, and following our successful merger, we became Liverpool University Hospitals from the 1st of October 2019, and our story today continues up to the 31st of March 2020. Now, our journey really begins with some key insights into the health of the population we serve. This slide distills a broad range of data and indicators to summarize the levels of health and well-being within our community. And it doesn't make great reading. I appreciate that it may be difficult for you to see all of the specific detail, but the summary points in the text to the right of the slide draw out some of the alarming truths around illness and mortality in Liverpool. At just 78.2 years, Liverpool has the second lowest life expectancy of English core cities. Cancer, circulatory and respiratory disease account for 7 out of 10 of early deaths. And the majority of our population, 55% of people, have a long-term condition. And worryingly, people with long-term conditions account for 60% of A&E attendances, 85% of all hospital admissions, 92% of mental health contacts, and 91% of community contacts. So these are generally not good outcomes, and worryingly, the trend for many of them has been heading in the wrong direction. And these sobering statistics taken with national and regional reports on the wider determinants of health that relate to social, economic, and environmental factors set the canvas for why Liverpool needs great healthcare. And for some time, including the first 6 months of the financial year that we're reporting on today, the clinical leadership of the two trusts focused on making the case for an appropriate response. Our clinical leaders recognized that their ability to meet the healthcare needs of the population were further compromised by the organizational status quo, with two separate trusts, two separate organizations, sometimes competing and sometimes duplicating services, and generally not making the best use of the human and physical resources available to serve the population. The case for merger put the patient and the communities we serve at the very center and articulated how, by merging, we could organize ourselves differently to deliver some key benefits. So those key benefits of merger included providing better healthcare outcomes, a better quality service, an improved patient experience, an improved staff experience, and much better use of our resources. And this case was so compelling and logical that we were delighted to have our merger approved and to have it take effect from the 1st of October. And that was the start point for our new organisation, Liverpool University Hospitals NHS Foundation Trust. And for the second half of the year, we focused on developing our vision and goals for our new organisation to provide clarity and direction for our staff, to set out exactly what we are here to achieve and how we will measure progress. Now, when I applied to become the chair of the trust in 2019, I was asked to articulate my vision for the new organisation. And at the time I said, for me, the vision needs to be all about people, serving our local population and valuing our workforce. We have the potential to focus beyond the mechanics of merger to see that the new trust is focused on benchmarking against the world's best providers of healthcare. We can deliver outstanding care. We can work with our system partners to address the significant health inequalities and unacceptably poor outcomes affecting our population. We can be a magnet for clinical, research, and non-clinical talent, growing the workforce for the future and providing a great place to work within the NHS. At the time, I said that was my vision for the new organisation. I said it then and I believed it, and I believe it even more today. And I am immensely proud that as a new organisation, through this, our strategic framework, we've set out our stall. We've said exactly what we're here to do and how we will measure our progress. So through this strategic framework, we've said our vision is totally aligned to the One Liverpool strategy and the city plan. Healthier, happier, fairer lives. Our purpose is to provide outstanding healthcare. We're focused on our 4 priority aims: great care, great people, great research and innovation, and great ambition. And under each of those priorities, we have a series of strategic objectives and very clear success measures. So that really has been our journey to go from understanding the needs of the population to conceiving of the merger, looking at how we can do things better, and capturing here in our strategic framework exactly what we're here to do. So my hope is that by the end of the meeting, you'll feel more knowledgeable about all of this and our key developments that have shaped the last financial year. Thank you very much. I'm going to hand over now to Andrew who's going to talk you through the Council of Governors report.
Okay, thank you, Sue. A little technical issue there. So our Council of Governors here at Liverpool University Hospitals consists of 31 governors. We have 16 public governors who are elected by you, the members. We have 8 staff governors covering the constituencies of medical, nursing, allied health practitioners and healthcare scientists and other non-clinical staff. We have 2 governors for each of those constituencies. And then we have 7 appointed governors from our partner organisations. These are Liverpool University, John Moores University, Edge Hill University, Liverpool, Knowsley and Sefton councils, and we have a appointed governor from the voluntary sector from YPAS. And those who may not be familiar with the foundation model, you, the members, appoint or elect us, the governors, and we are accountable to you. The governors nominate and appoint the non-executive directors, and the non-executive directors are accountable to governors. The non-executive directors appoint the executive directors, who are accountable to the non-executive directors. And we have a variety of statutory duties which are laid out, and they include the appointments of chair and non-executive directors. We approve the appointment of the chief executive officer. We hold the non-executive directors individually and collectively to account for the performance of the trust board. We appoint the trust external auditors, and we represent the interests of you, the members of the trust as a whole, and the interests of the public. Now, they seem quite woolly set of standards, and it's quite difficult at times to understand how we as governors actually fulfil those roles. So on the next slide, I want to talk you through what governors have done over the past 2 years to discharge their statutory duties. And we're going to go a little bit further back than 2019. We're going to start at the end of 2018. And here we started with task and finish groups. And we joined up with the Council of Governors from the Royal Trust, and we set up 2 task and finish groups where we determined how the relationship of the new trust would come about, how the membership constituencies would look, and how the Council of Governors would work. Along with that was also the arrangements for the new constitution. And under the NHSI's transaction guidance for trusts undertaking transactions, including mergers and acquisitions, that states that trusts must submit a proposed constitution for the new foundation trust as part of their application. And the Aintree Council of Governors, because at this point it was pre-merger, approved the new constitution and the transaction criteria in March of 2019. In May, we had the interviews and stakeholder session for the interim chair. This was a robust process, and the stakeholder session included clinical and non-clinical representatives of both trusts, as well as external representatives from universities, local authorities and clinical commissioning groups. We had 3 candidates, and they had to present to the stakeholder session and answer questions. And then they followed interviews with an interview panel. On that panel were 2 governors from Aintree Council of Governors and 2 from the Royal Council of Governors. Following that day, the panel recommended Sue Musson, who you've just seen previously, as their preferred candidate. And the Aintree Council of Governors voted unanimously in favour of appointing Sue Musson as the chair of the interim board on the 3rd of June. Following on from the appointment of the chair, the appointment of the chief executive was then continued. Again, there was another robust session. 3 candidates were selected for interview. This took place in July, and there were 3 factors there. Again, another stakeholder session, and where the 3 candidates had to present and do a Q&A to a large group of both internal and external stakeholders, which included clinical and non-clinical representatives, executive and non-executive directors, trade unions and governors from both trusts. Following that, there was a smaller focus group and then finally a panel interview. After thorough consideration, the panel identified Steve Warburton as the preferred candidate, and Aintree Council of Governors approved the appointments of Steve Warburton as Chief Executive of the Interim Board on the 11th of July, and you'll be hearing from Steve next. On the 23rd of September, at an extraordinary meeting of the Council of Governors, the Aintree Council of Governors agreed that the Board of Directors at Aintree University Hospital NHS Foundation Trust had been through a thorough and comprehensive process in reaching its proposal to merge with the Royal Liverpool and Broad Green University Hospital NHS Trust by way of an acquisition. It was agreed that the Trust had obtained and considered the interests of Trust members, the public and stakeholders as part of the decision-making process, including the development of a new constitution. And we approved that merger. The acquisition was then sanctioned by NHSI, and on the 1st of October this was completed with the formation of Liverpool University Hospitals NHS Foundation Trust. The election process began immediately for the new LUH Council of Governors, while the Aintree Council of Governors continued to discharge their duties until the 2nd of December, when the new council was elected and the results were published. As governors, we took part in an induction day soon after appointment. We had an induction day provided by NHS providers and the Trust's legal advisors, Brown Jacobson, where we were given good training on our roles and statutory duties. This was needed as very soon afterwards the governors met at their first Council of Governors meeting, where we undertook to appoint Sue Musson as chair and to approve the appointment of Steve Warburton as CEO. In both cases, LUH Council of Governors were unanimous in favour of those appointments. In early 2020, all governors were given the opportunity to be involved in the Nominations and Remunerations Working Group, and from this group, governors selected those that would represent the council on the Nominations and Remunerations Committee, and it was agreed that Doreen Schlecht and Dorcas Akeju, both public governors, and Graham Kemp, who's the appointed governor of University of Liverpool, would be members of that committee. The Council of Governors met on the 12th of March, where we carried out another statutory duty and we appointed the non-executive directors. And we approved the recommendation to reappoint Mike Eastwood, Tim Johnson, Neil Wilcox, Mandy Wern, Louise Kenny and Angela Phillips. To fill the remaining 2 places for non-executive directors, there was a formal, rigorous and transparent recruitment process which took place at the Cunard building, again involving a stakeholder session and then interviews. Many governors took part in that stakeholder session, me included, and we sat with members of the board asking certain questions to those candidates, and then there was an interview by the members of the Nominations and Remunerations Committee. The panel recommended to the Council of Governors to appoint Estuce D'Souza and Sheila Samuels as their preferred candidates, and the Council of Governors approved those appointments on the 21st of July. So you can see it's been quite a busy period of time, lots of meetings, lots of sessions, but along with those statutory duties, governors have also still been around on the sites and have still been involved in many other things. So we do have governor-led committees, and you've heard me talk about the Nominations and Remunerations Committee. We also have the Membership and Engagement Committee, which supports governors to fulfil our statutory responsibilities to represent the interests of trust members, that's you. The committee does this by developing and reviewing processes and activities for the recruitment and engagement of new and existing members of LUH, NHS Foundation Trust, in line with the membership strategy. The LUH membership and engagement strategy is published on the Trust website for any member that would like to take a look. We've also, this is pretty much pre-COVID, but we also take place in, say, place assessments. These are assessments of about 4 wards usually, in line with domestics and facilities management teams, where we look at the non-clinical aspects of those wards. How clean are they? How dirty are they? What's the state of the beds? Very useful that that's fed back then up into facilities. We're usually involved in the promotion of flu vaccines, and as well as attending, but we also were judges with the Aintree Excellence Awards, which were a great evening once a year where staff were recognised for excellence within their departments or groups. And of course, we took part in quite a few merger public engagement sessions. But as well as governor involvement, we also have quite a bit of membership engagement. If you were wandering around the hospitals, you may have seen a membership stand that we used to put out every so often, where we would try to engage with members of the public, maybe get you to join as a member to explain the benefits of membership and of governors. We also attend the volunteer inductions, and staff governors attend the corporate induction sessions. But of course, with COVID, these have now gone online. So, okay, like we've sort of alluded to, COVID has put a halt to a lot of our face-to-face engagement with members, and we will continue obviously to follow government guidelines with this, but we hope that we can plan on-site events and engagement activities with members in the future. Until then, we plan to communicate with our members virtually using programs such as these. So I'm now going to hand you over to the Chief Executive, Steve Warburton.
Okay, thanks very much, Andrew. I'm going to talk us through, I think, two sessions really. Talk a little bit about the performance for April 19 to March 2020, and then talk about some of the benefits and highlights of the year. So as has been explained on a number of occasions, the two organisations formally came together on the 1st of October. That was the merger of Aintree and the Royal Liverpool. And that had been something that the city and the clinicians and the two organisations had long wanted to bring together. We'd started that process a number of years before, but had to go through a whole kind of process of due diligence, working with the Competition and Markets Authority, and a whole degree of scrutiny and assurance to basically make sure that the new hospital will be get off to the best possible start. So as a result of that, we've actually created one of the largest university teaching trusts in the country. We've got more than 15,000 staff. I'll talk about the whole-time equivalents a little bit later, in case anyone eagle-eye spots the difference in the numbers, but it's about 15,000 people work for us, and our turnover is just under £1 billion. Now, as I'm sure you'll all appreciate, we provide a wide range of acute and what we would term DGH services to a local population of 630,000, so very much for the populations of Liverpool, Knowsley, South Sefton and parts of St Helens. But what people don't always realise is that we also provide a very wide range of specialist services to a catchment that includes most of Cheshire and Merseyside, but also reaches into other parts of the North West, Cumbria, Lancs, and indeed to the Isle of Man. We've got ambitious plans to improve the quality of the services that we're providing, and we also want to focus on attracting world-class research, which were again some of the strategic rationales and anchors for the merger in the first place. So when we talk about sort of integration and bringing the organisation together, I think the easiest way to think about it is in two compartments. There's the reconfiguration of clinical services, which was the clinical driver for the new organisation, and I'll touch briefly on that. I know Paul is going to cover that. But there's also the integration of the management teams and structures as we actually bring two organisations together. Now, of course, many hospitals have actually merged in name only, but we wanted this to be a genuine bringing together of the two former organisations. And so in order to do that successfully, we've actually recruited staff into the various tiers or levels of the organisation to make sure we've got that proper integration. And in terms of giving you an example of what that would mean in practice, we've created 5 divisions as part of the Liverpool University Hospitals, but actually we just want a single division of surgery. So that single division of surgery is operating across our multiple sites with a single clinical director and a single senior leadership team within that division, rather than having the sort of the Aintree surgical structures and the Royal Liverpool or Broad Green surgical structures. So that's what we mean when we're talking about organisational integration. And as you can see from this slide, we've kind of organised the structures into various tiers, and we were hoping to get all of that process completed by the end of March. But really, with the advent of COVID-19 and the operational challenges, and we needed to make sure that we were able to keep the hospitals operating throughout this period, we didn't quite make the progress that we'd made. So we're currently down to kind of tier 3, but we'll be cracking on with the rest of those appointments as we move through the year. So just in terms of our CQC ratings and where we stand, obviously we've got a number of sites. So overall, we've got a CQC rating of good, which I'm really pleased about. And actually, we've got one of our sites, the dental hospital, which was actually rated outstanding. And just in terms of trying to get some of what that looks like in terms of scale of the organisation, you can see that we see just under 1 million outpatients a year. We've got just under 400,000 emergency department attendances, 200,000 patients are seen as inpatients, and we've got over 1,600 beds. So that, by any measure, that's a very large organisation. And then you can start to see how our patients are actually rating us. So just around 82% of patients who attended the emergency department would recommend us to friends and family, 93% for inpatients, and rising to over 94% for outpatients. You can see a breakdown of the staff numbers we employ by staff group. Now that's actually expressed in whole-time equivalents. So anyone who's eagle-eyed enough and wants to add those numbers up will find they add up to just under 13,000. But that's the difference between the two numbers and the total staff we employ. And you can also see from that slide, we've got over 21,000 Foundation Trust members, of which 8,500 are public members. So just in terms of this slide really shows how busy we've been and continue to be by showing the numbers that we've seen in our emergency departments over the last 5 years or so. You can actually see there that in terms of emergency department, I've mentioned that we had just under 400,000 attendances, but that actually represented a 6.7% increase on the previous year. So we've seen ourselves getting busier and busier. And that's then obviously reflected in the 3% increase in inpatient admissions that are coming into the hospital. Remember, all of these numbers are up to the end of March, so only really include a week of lockdown. So it's a fairly good representation of what we did in 1920. Clearly, when we come to review the current year in 12 months' time, things will look somewhat different because of COVID-19. So this slide shows where we are in terms of our performance against some of the key operational standards. They're not necessarily where we would like to be, but I think these numbers always have to be put in terms of how the rest of the NHS is performing. So despite the combined performance for the A&E target against a target of 95%, actually achieving 84% actually made us one of the better performers across the Cheshire and Mersey region, and indeed across the northwest. And we actually saw a dramatic improvement in terms of flow of patients through both the emergency departments here at the Royal Liverpool and also on the Aintree site. So actually the handling of winter is actually something we felt went pretty well. Clearly, the time it was taking our patients to get access to elective care in terms of the referral to a first definitive treatment waiting time, the target for that was 92%. And we've seen that we had some challenges around the achievement of that target, and that's obviously proved to be an increasing challenge as we've gone through this year with the cancellation of elective activity at the beginning of this current year due to COVID-19. Of course, when we're looking at these targets, we are making sure that patients are being clinically prioritised and that we're keeping a close eye on those patients who are not getting in within that 18-week time frame. But again, this is something that we've seen that deterioration right across the NHS. On a kind of more positive note, we've seen some good performance in some of the cancer targets. Particularly around cancer weights for first appointment for breast cancer at 96% within 2 weeks, and the surgical decision to treat within 31 days of 95%. The one, again, where further improvement is definitely required is around the 62-day target. I think in terms of diagnostic weights, we were actually not doing too badly, but again we saw some deterioration of those, and that's something that we're trying to pick up in the current post-COVID reset. I think I've touched about A&E, so we can. So in terms of our financial performance, as been mentioned, the two organisations merged in October 19, and that sort of gave us some headaches in terms of actually producing the accounts and actually how we present the financial information. So therefore, if we're trying to think about the end of year position for Liverpool University Hospitals, then the accounts include the full year of Aintree and the final 6 months of the Royal Liverpool. So we actually had to produce a separate set of accounts for the first six months of the Royal Liverpool Hospital. So therefore, when we're looking at the full year performance, that combines the two trusts for those periods. So Liverpool University Hospitals, and then we've got the separate reporting period for the Royal. I'm pleased to actually say the finance results for both organisations and the combined trust actually improved year on year, and as a result we were also able to make significant capital investment. So despite having a despite having a deficit, we actually managed to meet our kind of control total overall, and therefore with some support that we received, we were able to achieve a small surplus, and we actually managed to get a bonus of £9.1 million as a result of that, which we were very pleased for, and that will support ongoing patient care. We got a use of resource rating of 3. And we delivered, despite the challenges, we delivered our efficiency programme and delivered £13.6 million in cost improvements and efficiencies. We also managed to invest over £100 million of capital in estate infrastructure, equipment and technology, which again is a really good news story. And we've continued through, again, being able to attract new capital investment. We've been able to continue that investment into capital in the current year as well. So just in terms of some of the key financial highlights, these are showing the kind of, again, the combined position shows the overall position for the trust. So you can see a combined sort of turnover there of 970 million, which includes 774 million of income from patient care activities and 196 million of other operating income. And then in terms of our expenses, you can see basically our operating expenses of 978 million and 18 million of finance costs, which includes kind of loan repayments and things like that. So again, you can kind of see there that we are currently spending more than we're getting in, which is why we have the underlying deficit, which really is kind of highlighted in this particular slide, which shows the underlying deficit for both the Royal and the combined organisation, and then the combined position. But that was actually in line with the target that we've been set to achieve, so that was considered a good financial performance. And in terms of the operating expenses, the graph below just shows the split there between pay and non-pay. So you can actually see that we're spending about 61% of our total operating expenses are going on pay, and then we've got the other 383 million being spent on non-pay. So just in terms of the formal part of this annual members meeting, we do actually have to present our audited accounts for the year 1920. So I've kind of covered what I would call the main financial performance, but this next bit will just show you a few slides taken from the accounts. But I would say the full set of accounts are actually available on our website, and anyone who's keen to look at them should go there, or if people want to request a copy, then if they get in contact with us, then we can actually send out a copy of the accounts. So I'll just sort of take you through these slides very, very quickly indeed. So this first slide is a statement of our kind of comprehensive income. Again, it's slightly challenging because of the way that the position was used in terms of the part year reporting. So when we're looking at the 18-19 position, that is the position just for Aintree, and then obviously the 19-20 position is the Aintree position plus the Royal Liverpool position for the final 6 months of the year, and that shows us with that small operating surplus from continuing operations of just over £2 million. We've then got the statement of financial position, which kind of gives us just that kind of breakdown of kind of current assets, liabilities, etc., and how that's been financed. Again, I'm not going to go through that in detail, but that is all available in the accounts with the notes that accompany it. That's our third slide, is our statement of cash flows. And then we've got a second slide that just kind of finishes that off as well. Okay, so now I'll talk about some of the benefits and highlights of 19-20, which was a sort of challenging year, I think, in terms of many of the things we were trying to do. It was when Andrew kind of reminded us of some of the process that we've been through, and particularly the start of the organisation and the appointment process. It seems much longer than just over 12 months ago. And obviously here we're only talking about up to the end of March, but of course for all of us who are actually here today, we've actually had the last 6 months of kind of managing in COVID. So Sue mentioned at the start of the presentation about wanting to put people at the heart of what this organisation was going to be about. And in fact, when we talked with our kind of regulators at the time that the merger was being approved, we actually felt that bringing the organisations together, bringing our teams together, that was going to be the most important thing that we would have to do. A lot of the kind of transactional and the technical stuff, we kind of manage that, but actually if the staff didn't want to make this be successful, then it wasn't going to happen. And of course our merger was unique in terms of the clinicians across Aintree and the Royal wanting to drive that merger in the first place. So we really wanted to make sure we could capitalise on that enthusiasm for bringing the hospitals together and take it to the next level. So we involved our staff very significantly. We ran a number of engagement events in terms of the development of our new values and behaviours framework. And I think when we look at the values that our staff came up with about being a caring organisation, being a fair organisation, and being an innovative organisation, those are values that I think we can all get behind, and also I think capture something about the kind of the Liverpool sense and the Liverpool people. So I think we can all get behind those, and they're an excellent set of values as we move forward. And those are values that, yes, we want all our staff to live by, but they're also the values that we want the organisation and its leadership to be judged by. We've launched a new Chief Nurse Scholarship programme, which is aimed at engaging nurses in research to improve the care that they're able to provide as part of a master's degree. And we're going to be really pushing forward on what we're doing around that kind of whole kind of research piece. We're working in partnership with academics in the University of Liverpool, Liverpool John Moores University, and especially recently around the Liverpool School of Tropical Medicine in terms of how we can move that research agenda forward. One of the main sort of drivers for the merger was to actually improve Liverpool's standing of both the predecessor trusts in terms of how we're doing in terms of research, and we really wanted to put research at the forefront of what we're doing as an organisation. All the evidence suggests that organisations that are recruiting patients into trials actually improve patient outcomes. So this isn't so much about kind of boffins in darkened rooms. This is really about using research to improve the care that we're able to deliver to our patients. And I'm pleased to say that we're delivering over 600 research studies with over 250 research principal investigators. And really we are embedding this culture of research in the way that we do things. Again, we've seen during the COVID challenge, we've actually seen Liverpool being one of the biggest recruiters nationally. I think we're sitting something like third or fourth in those kind of national league tables in terms of the number of patients that we've been able to recruit into trials, and that'll obviously then help drive improvements in treatment. So a really important part of what we do. We were also approached, and this approach sort of started prior to the merger, but the filming was actually undertaken almost just as we merged. So the film crews were across our hospitals throughout sort of October, November and through into December, and extensive filming was undertaken with our kind of frontline staff. So Liverpool University Hospitals featured in, I think it was at least three or four of the episodes of BBC Two's highly acclaimed hospital series, which had an average of 2.2 million viewers. And the Trust had an awful lot of really positive feedback on that programme. I think particularly what came across was the commitment, the humanity, and just the sort of the drive to provide the best possible care for our clinical staff. And I think it was a great advert for the organisation. We were also in January 2020, we were granted the freedom of the City of Liverpool by Liverpool City Council in recognition of the work that the hospitals had been doing and the benefit that they'd given to and service to the local population. So obviously we were actually due to be collecting our award and having a kind of ceremony, and then as is often a theme this evening, COVID struck. But we are hoping to be able to get some kind of handover and presentation, because again that's just a really important recognition for our staff about how they're valued by both the council, but I think also more broadly by the people of Liverpool. So I'm very pleased about that. And despite all of those challenges, we've been able to make really good progress on the new Royal. 12 months ago, particularly when we were starting to look at this, we were faced with some literally unprecedented engineering challenges. The sort of the problems that the hospital had faced in its construction following the collapse of Carillion were well documented, but we really had to move into what were the engineering solutions going to look like to enable to get complete and enable us to deliver the hospital, which the new building which the hospital so badly needs, and of course the city and the wider region so badly needs. So I'm delighted to say that with a huge amount of effort and joint work, particularly with Lango Rourke, who took over the construction contracts after the collapse of Carillion, we've been able to develop some really innovative engineering solutions, which are coming to that point now where we're actually increasing confidence around the kind of the handover of the hospital and starting to think now about moving in. So we're not totally confident yet about that date, but we've been able to keep all the work going throughout the COVID pandemic, and we're optimistic that we'll be thinking about moving into the new hospital around spring 2022. And certainly for the operational teams who are starting to think about that, that's only 18 months away. So I think that's a great challenge to have. And of course, the opening of the new hospital will give us an ideal opportunity to actually think about how we provide services going forward between our respective sites. So what we're doing on the Aintree site and what we're doing here. So there's going to be a huge amount of planning work, but it's a fantastic news story for Liverpool University Hospitals and the City of Liverpool. So just in terms of what's been happening around COVID, we very much saw the hospital at the centre really of the COVID response for Cheshire and Merseyside. Liverpool saw very high levels of infection, and we saw lots and lots of poorly patients in the first wave. So in that first wave, we cared for over 1,500 patients who needed to come into the hospital, and a significant number of those were managed through our level 3 critical care beds. We also created additional CPAP capacity. We had to train more than 600 staff who were redeployed and trained to work in other areas of the hospital than maybe where they'd worked before. So that was a massive mobilisation from staff working in other areas to actually make sure we could get them to the areas where we needed to increase that capacity. We worked again with Lango Rourke about specially commissioning and opening up a part of the new Royal Building, which we named the Agnes Jones Unit. So that was actually housed in an area of the Royal, which is now going to, in the future organisation, will form part of the emergency department. But that area was well developed in terms of the building, and we were rapidly able to commission that into a discharge facility where we could put some of our recovering patients and make sure that they could be safely looked after prior to any discharge back into care homes, and we could actually make sure that they were safe for that discharge in terms of COVID status. We retained our emergency, urgent cancer work throughout COVID. So yes, we weren't as busy as we normally were because of the stepping down of the elective programmes, but we do an awful lot of emergency and cancer work, so we were still very busy as a hospital. And obviously one of the challenges that we faced throughout that first surge in COVID was actually making sure that we had adequate supplies of PPE to make sure that our staff and patients were safe throughout that period. And again, you know, thanks to sterling efforts from a wide range of people, we had some challenges when we thought we were getting pretty close, but we never actually ran out, and we were able to maintain those safe supplies. Liverpool Clinical Laboratories, which is our major labs here, which are based in the Duncan building here on the Liverpool site, were very firmly established as a kind of regional testing centre for the testing of COVID and also for supporting antibody testing, and we're continuing to do that to this day. So we're currently in discussions with government about how we can put more analysers and get more testing through our labs. And we had some particular challenges also around making sure that we had the oxygen systems and supplies, particularly in an old building like this current one here at the Royal Liverpool, to make sure we could actually cope with all the increased demand for oxygen that we was going to be need to support COVID patients who were receiving ventilation or CPAP. So this is a pretty busy slide, so I'm not going to kind of go through all the things that we've been doing. It's really just kind of shows some of the key highlights. So despite dealing with that kind of pandemic, which has very much characterised the last 6 months, there was an awful lot of activity kind of going on at the beginning of the period since merger, which is what the time period is characterised by this slide. I think the thing that I would point out that, you know, very much soon after sort of formal integration and merger, we did undertake what we termed the phase 1 integration around trauma and orthopaedics to create that single service, and that was at the time that was one of the largest service reconfigurations being undertaken anywhere, and obviously that formed part of the BBC Hospital series. but we'll come on to that in a little bit as we talk about future clinical integration. So it's been, I think, in terms of concluding comments, it's been a challenging year. It's been a rewarding year. As always, we couldn't have done all the things that we've done without our magnificent staff and the efforts that they really have gone above and beyond. And that was especially evident during the height of the COVID pandemic. Unfortunately, as we're sitting here tonight, we're seeing a significant increase in COVID cases, and we're going to be calling on those magnificent staff to get us through the challenges once again. I'll now hand over to Paul.
Hello, good evening. It's a pleasure to be able to talk to you this evening about our integrated future together. One of the key features of our merger, and one of the things that sets it apart from almost any other merger in the history of the NHS, is that this merger was driven by clinicians, that is doctors and nurses, wanting to come together to deliver better outcomes and better healthcare to the people of Liverpool who we serve. And despite the pressures of COVID, we've been able to really progress with some of that ambition to deliver that great patient care, which reflects the absolute drive and passion of my great colleagues who have worked so hard to do that. Examples include the fully integrated elective ENT service based around the world-leading Head and Neck Institute on the Aintree site, delivering levels of care that wouldn't have been able to be delivered on the Royal Liverpool site before integration. And the integration of the regional blood cancer service with our colleagues at Clatterbridge, allowing that service to be housed in those world-class facilities of their new hospital. But what I'd really like to talk to you tonight about is the integration that has happened in our trauma and orthopaedic services, which, as Steve mentioned earlier, was undoubtedly one of the biggest transformation and integration projects anywhere in the NHS last year. By coming together, we've fundamentally changed the way in which we deliver trauma and orthopaedic services to the people of Liverpool. And as you can see in our previous model, before we merged and integrated, we had bits of trauma and orthopaedics all over the city. It was fragmented. Patients had to move between hospitals. It was inefficient with some services in one place, some services in the other, and patients having to flow between the Royal Aintree and Broad Green sites to get that care. And for patients, that meant longer waits and a waste of public money. Through the merger and then through the integration work after that, we've changed this. We've centralised trauma surgery and trauma assessment on the Aintree Hospital site based around the region's award-winning and nationally renowned major trauma centre. And on the Broad Green site, we've centralised our elective surgical care, joint replacements, and other elective procedures to deliver one of the country's biggest and most effective orthopaedic elective units. And that's helped us make those services more sustainable, more efficient, and provide better training opportunities to our staff. But more than that, most importantly, it's improving outcomes and care for our patients. And by reorganising the service in that way, we're making sure that every patient gets the very best care that we can provide and that they get that care quicker. Examples are, in trauma care, we now have a daily trauma list at Aintree. People wait less long now to get their bones fixed after accidents than they did last year. Or on the Broad Green site, we've got reduced waiting times for expert orthopaedic elective surgery. Patients aren't waiting as long for their hip and knee replacements in Liverpool as they did a year ago. And we also know that by combining these services and centralising them in one place, our surgeons perform a larger volume of surgery, and we know that produces outcomes, improves outcomes. So not only are people getting their operations quicker, they're getting better outcomes because of the volumes that we're able to do. Moving forwards, we've got a number of major service transformations in line and that we're entering consultation over: stroke services, general surgery,
elective surgery, spinal services. But in the meantime, every single one of our services working on integrating across the Broad Green, Royal and Aintree sites. And the message and the spirit we've gone into that is we're taking the best of the lot. This is a race to the top. It's about providing the absolute best care to our patients, with the aim of ensuring that every patient, irrespective of where they live in Liverpool or which hospital they present to, can benefit from the same great care that we're striving to provide through growing great people, through great innovation and great ambition. Thank you. And I'll now hand you back over to our chair, Mrs. Sue Musson.
Okay, thank you very much. At this point, we would be providing answers to questions, but I'm just confirming that we haven't received any written questions. So that really draws our first annual members meeting as Liverpool University Hospitals NHS Foundation Trust to a close. I'd just like to say thank you again for taking the time to join us and to listen to the presentations. I hope you feel more informed about the very significant developments that have been occurring over the last financial year, and please keep supporting us because we're facing a lot of challenges in a busy future, but we are absolutely excited about providing the best possible care to our city. So thank you very much for joining us, and see you again. Thank you. Bye now.